My name is Shyam Prabhakaran. I served as chair of the writing group for the 2026 American Heart Association, American Stroke Association Guidelines for Early Management of Acute Ischemic Stroke. Along with my vice chairs, Doctors Nestor, Gonzalez, and Kori, Zachrison, we were tasked with assembling a team of stroke experts and survivors to assess the scientific literature of new evidence published since the prior guideline in 2019 that support recommendations in the care of acute ischemic stroke patients. Impactful new research on pre-hospital management, thrombolysis, thrombectomy, and medical management of blood pressure and glucose were among many new scientific advancements that informed the new guidelines we developed. I'm going to hand this over to Kori to talk about pre-hospital care and systems of care.
Thanks, Shyam. The first point that I am excited to share an update on is related to management of destination choice in the pre-hospital setting. And so the guideline recognizes the complexities associated with destination management in the pre-hospital setting and incorporates those nuances into the recommendations. And so in areas with well-functioning systems and rapid inter-hospital transfer processes, the guideline finds no benefit of bypassing a proficient thrombolysis-capable hospital for a different EVT hospital. But we know such settings aren't universal, and so in other settings and conditions, the guideline endorses consideration of direct transport to the closest EVT-capable hospital. As a second point, I want to draw attention to some updates related to inter-hospital transfers and systems of care. As inter-hospital transfers of stroke patients are becoming increasingly common for access to higher levels of resources and care, including EVT, the guideline includes specific related recommendations. This includes the importance of established agreements and protocols to prioritize inter-hospital transfer of acute stroke patients and reduce door-in, door-out times for transferred patients.
Thanks, Kori. Yeah, those are really important updates. There were also updates in the medical management of acute ischemic stroke patients. The guideline emphasizes, in a new way, individualized thrombolytic treatment decisions based on a broader approach to eligibility determination in patients with disabling deficits. Importantly, tenecteplase is now recommended as an alternative to alteplase for eligible patients within 4.5-hour window. Extended thrombolysis windows were also recommended up to 24 hours and were supported for select patients using advanced imaging criteria. In patients who receive reperfusion therapies, maintaining systolic blood pressure below 180 milligrams of mercury is recommended, as intensive reductions below 140 milligrams of mercury does not improve outcomes and actually may cause harm. Another update related to glycemic control, tight glycemic control to levels of 80 to 130 milligrams per deciliter is not advised due to risks of severe hypoglycemia. Instead, levels between 140 and 180 are preferred. So I'm going to hand over now to the major updates related to endovascular therapy and some pediatric recommendations. Nestor?
Thank you, Shyam. These 2026 guidelines are very exciting because of the expansion in the indications for the treatment of patients with acute ischemic stroke with endovascular techniques. Endovascular thrombectomy has become the standard of care for patients with acute ischemic stroke due to large vessel occlusion, supported by numerous randomized controlled trials. The 2026 guidelines now extend this therapy to populations previously considered ineligible, specifically for patients with larger ischemic cores as determined by imaging. Additionally, the guidelines provide strong evidence-based recommendations for thrombectomy in patients with vascular artery occlusion presenting within 24 hours of symptom onset. Now, stroke affects patients of all ages, including children. For the first time, the 2026 American Heart Association Acute Ischemic Stroke Guidelines include dedicated recommendations for the recognition, diagnosis, and treatment of pediatric stroke. While much work remains in this field, the guidelines now support strategies for early recognition, appropriate imaging selection, and the use of endovascular interventions performed by experienced operators. These recommendations establish a foundation for future efforts addressing all phases of pediatric acute stroke care.
Thank you, Nestor. Those are really exciting developments. I want to thank, we all do, the writing group members for lending their considerable expertise and dedicating their time and energies over the past year plus. In addition, this guideline wouldn't have been possible without the tireless team, the AHA, American Stroke Association staff who supported this writing group throughout. We want to encourage everyone to read the new acute ischemic stroke guidelines, which are now published in the journal Stroke. Thank you.